We actually started the implementation of the MOU in April 2022, and it's a 3-year program. Before the implementation, our immunization coverage was at 49%. But as I speak, we've even surpassed the national target of 80%, the immunization coverage in Taraba State, and kudos to this MOU, the support from GAVI, UNICEF.
This is Kama Health Clinic. 2022, I come and register for antenatal. They treat me well. Rather, this place is not good like this. But this 2025, before I come for another antenatal, the place is fine and they are treating me well.
With the GAVI MOU, we're also able to improve the facilities. If you go to the facilities, you would see how the facilities have been upgraded and have been made more functional in terms of service delivery.
We thank the government for bringing this facility to this place. Where this facility is not here, even when the nurses and the doctors are not here, we go to Yinagwa to take our treatment. But since they are living here with us, we don't find any difficulty. Anything we need them, they are available.
Ina zaune gida, mobilizer ta shiga gida tana gaya min cewa ga masu rigakafin nan sun ƙara dawowa. Shine na kawo yaro na. Ina da yara 3. Wannan shine na 3. To na masu rigakafi. To amma yanzu wannan ne na ƙarshe, na kawo shi an kama shi ta na Kongolo. Shekaran shi 1 da wata 3. To muna jin daɗin wannan rigakafin da ake yi. Da muna ɗan ganin kaman ba yi ba ne, akwai matsala ne ga mutane, amma yanzu mun ji daɗin shi kuma muna godiya ga wannan ƙungiyar.
GoHealth is the health insurance agency in Gombe State, and one of the priorities given was to ensure that people go to health facilities and attend health services without paying from their pocket. UNICEF came to Gombe State and look at how are they going to come in. So they came through a window. So what they did is that they asked us to enroll 10,000 children and women that are caregivers from indigent population. UNICEF paid premium of these 10,000 people at the rate of 12,000 naira per annum per person.
GAVI implemented health insurance coverage in Bayelsa. Presently, we are covering 10,000 people, which they have already paid for 1 year.
Mun samu rahoto daga mai unguwa ya ce mana mu zo a taro za a kawo wani tallafi da za a kawo wanda za mu rinka kawo yara asibiti wanda za a rinka ba su magani kyauta. Shine mai unguwa ya tara mu muka zo muka anshi form din muka cika, bayan mun cika shine muka fara kawo yaran asibiti.
We have Mama to Mama. These are women that it's a voluntary organization. They are being brought together, 30 women per political ward. In Taraba State, we have 16. So we have 5,040 women that come together every month they meet.
This program of Mama to Mama started here in our local government right from May 2023. The work we do here is to tell women, to enlighten them on how it is important to go to the health facilities so that it will better their health and the health of their babies.
It has been found that when women either going to Angola or going to hospital in groups, they discuss personal issues, their house issues. And GAVI, UNICEF, this MOU, look at it and said, okay, why can't we leverage on that the women? They should be sharing health issues. They should be talking to themselves, referring women from the community to the health centers.
Before, I was volunteering for good 8 years, but thank God for the opportunity of GAVI. I'm now a GAVI staff. And before, they don't used to pay us, but this GAVI, when I got the GAVI, they used to give us a salary every month. The salary contributes a lot to my family, my children. I can support my husband. Before, I asked him of transport fees, but now I can do that myself. I
want to use this medium to appreciate the GAVI UNICEF MOU that the state signed, because the movement of these vaccines from the state central coastal to the last mile is actually being sponsored by this GAVI UNICEF MOU.
If you take it a little further, even the vaccine push and pull, there were provisions for vehicles and boats on water that has supported vaccine push and pull and as well supported outreaches.
Last year too, we were given 6 ambulance boats which were distributed to our riverine primary health care centers, and these have helped a lot because it helps in conveying emergency cases from all those places to where they could access treatment.
With the support of the MOU, we conduct what we call reconciliation meetings every month, such that the register, the immunization register, is being brought, and then all the health ambassadors in the catchment area of that facility also come, so that we reconcile what they have in their registers as community persons, and then what do we have in our own register, what gaps do we have, which child has not gotten his vaccination. So by that we were able to penetrate to a lot of settlements, and GAVI MOU has taken care of the transport of those Jakada Lafia to that reconciliation venue.
The UNICEF brought in what we call SEDGE for to move them from a manual accounting system to a digitalized accounting system. So the SEDGE 200 was introduced. We were able to install it for them, to train them, and right now they are using it to produce their financial reports.
We've been able to digitalize the accounting record keeping in the agency. We've used the SEDGE 200, and that has really been impactful because with digitalization, it has further streamlined the financial management processes.
Post MOU now, because now we're going to the closing out phase. The state has laid foundation and strategies in place to ensure that we sustain all the good gains that we have gone.
The state was able to revitalize 168 PHC facilities.
Significant milestones achieved with the GAVI investment are the testimony of our joint support to improve the life of every child across the 8 states in Nigeria.
In 3 years' time, the achievement, what we have seen so far, they are significant.
The investment made in last 3 years to the primary healthcare centers have significantly reduced the under 5 mortality, increased the access and coverage of routine immunization, as well as strengthen the health system at the state level.
The other strategic initiative within this was to involve the governors at the state level, which has a long-term positive impact. We hope that government will completely own this program now and will bring it forward to provide essential health services to women and children in Nigeria.
I'm really, really proud of everyone who contributed towards the success of this program.
I'm really excited about this program, and really this initiative has brought very positive impact for well-being of children in Nigeria.